Coordinator acting for the Ministerial Task Force for Trafficking in Person, Danielle Griffith, says the issue of human trafficking remains one of the most hidden crimes in Guyana due to difficulties in recognizing it. And while multiple stakeholders are making stringent efforts to combat this crime, it continues to increase. New data released by the Counter-Trafficking in Persons Unit revealed that Venezuelan nationals are the most trafficked group of people in Guyana. A virtual discussion on the issue Wednesday included representatives from the International Organization for Migration, IOM, the Department of Citizenship, and the C-TIPU unit. The discussion is part of a week of activities to commemorate World Day Against Trafficking in Persons, which will be observed on July 30th. Data from 2018 shows a drastic trend of Venezuelan migrants being trafficked in Guyana. 337 Venezuelan migrants were victims of human trafficking since 2018. Other groups affected include Cubans, Haitians, persons from the Dominican Republic, and Guyanese.
There's a trend now moving from predominantly alleged victims were Guyanese moving out of foreign nationals, particularly Venezuelan nationals. You've noted and this could be the influx of the non-nationals within our country of lately and the growing economic crisis.
It was further highlighted that 90% of the cases were females with an average age of below 27 years old. Globally, women and girls are most vulnerable to becoming victims of human trafficking and are trafficked largely for sexual exploitation. Project coordinator for the International Organization for Migration in Guyana, Monserrat Hernandez, in her presentation said that migrants experience difficulty acquiring jobs and accessing public services, and this makes them more vulnerable to trafficking. And now with the COVID-19 pandemic, the migrants are faced with additional challenges and barriers.
We also know, and we've seen this situation aggravated as well in these last couple months, persons resorting to what we call negative coping mechanisms in order to have income to cover their basic needs such as food, shelter. So they resort to these activities, which tend to put them at more risk of being victims of human trafficking and gender-based violence.
In its response to COVID-19, the IOM has been working with the Ministry of Public Health to translate COVID-19 precautionary measures in Spanish, Portuguese, and Haitian Creole. Between April and June this year, IOM has assisted 307 migrants with shelter and food subsidies, 1,031 migrants with basic food supplies, and 929 with hygienic and sanitizing items.
For us, we have been concentrating a lot on the provision of humanitarian assistance, and particularly in the last couple months, we had to step up that response. So that means we have been providing with the shelter, emergency shelter, some rental subsidies. We provide also with food assistance and non-food assistance. Of course, this is a process. We do some assessments at the different organizations. We have our own procedures because, of course, we know that a lot of persons are in need, but we do need to see who are the persons that are in a most vulnerable situation, given the limited resources. So we do have a procedure. So we need to do an interview to identify as well, like what are the main needs, and also if there are any additional needs that the persons need.
Meanwhile, IOM's national coordinator in Guyana, Oliver Profitt, said under the Victim Protection Project, victims of human trafficking are also assisted with psychosocial assistance, small business grants, and some have returned to their countries. A policy adjustment to allow Venezuelan migrants a minimum 3-month stay in Guyana to access food, shelter, and medical care started in 2018. A multi-agency coordinating committee led by the Ministry of Citizenship was also established to address the need of Venezuelan migrants. Reporting for the newsroom, I am Isanella Patwo.